Okay, now what we're looking at is going to be congenital hypothyroidism. Okay, so in congenital hypothyroidism, the pathophysiology is basically there's going to be an insufficient thyroid hormone production, so T3 or T4. So you don't have enough. That's why it's hypothyroid, low. Congenital means you're born with it, so you were born like this. So it could be a genetic mutation, or it could be because of a iodine deficiency or excess. So if you have too little or too much iodine, it can cause hypothyroidism. Signs and symptoms of hypothyroidism in infants or pediatrics in general. They're going to be lethargic, hypotonia, so their muscles are going to be not as reactive. They're going to be having delayed growth. They're going to be a sleepy baby. They're going to be delayed mental responsiveness. Their fontanelle, the posterior fontanelle, is going to be open. They'll have coarse faces with short neck and short limbs. They'll have edema around the eyes, so periorbital edema. They're going to have enlarged tongue, poor sucking response. Their skin could be pale or mottling, or it could be yellow. It'll be cool, dry, and scaly. They'll have bradycardia, so low heart rate and low blood pressure as well. And they could have umbilical hernia, or they could have a mass because of constipation. So everything's slow, just like in an adult. But sleepy baby is pretty a main one. Same as poor sucking response. And the skin. So treatments for this. You want to give levothyroxine. So the starting dose is 10 to 15 microkilograms per kilogram per day. So the thyroid function tests are performed every 2 weeks. The way you want to give it to them is you want to crush it and give it in their milk, formula, or water. But don't give it in a full bottle, so like that the baby can finish. You just want to put it in like in the nipple part. It is affected by soy-based formulas, fiber, and iron, so you don't want to give it with any of those things. So this med will be needed throughout the child's life because hypothyroidism is something they're going to be born with, so it's not something that they developed and that you could just change. It's going to be something that they're always going to deal with. So you're going to encourage the family to get a medical ID bracelet or a necklace because it's something they're going to have to live with. So nursing management, you want to monitor the growth. So you're going to check their thyroid levels. You're going to measure them every 2 weeks until they tell you that the med dose is stabilized. So you want to make sure that this is working out. So every 2 weeks, you're going to go check your thyroid levels until when your meds are stabilized. Then every 1 to 2 months, you're going to go until your child is 1. And then after they're 1, every 1 to 3 months, you'll go until your child is 3. So let me repeat that again because it was a little bit confusing. So you're going to check your thyroid levels every 2 weeks until your med of levothyroxine is stabilized. Once that's stabilized, you're only going to go 1 to 2 months until they're 1. Once they're 1, you're going to go every 1 to 3 months until the child is 3. So if the tongue is large, it can, because remember we had the enlarged tongue. If the tongue is large, it could be obstructing the feeding ability. It could prevent airway. And you just want to make sure to position the infant on their side to prevent airway obstruction. Signs and symptoms of thyroid hormone overdose. So they'll be very irritable. They have a fast heart rate, dyspnea, sweat, and fever. Signs and symptoms of this treatment not working is fatigue, constipation, and decreased appetite. So these are the things that you want to kind of focus on. I think they're really going to focus on hormone overdose. So they'll be irritable, high heart rate, can't breathe, sweat, and fever. That means that this is too high. And then if it's not working, you'll essentially have some of the same signs and symptoms. So fatigue, they'll be lethargic, they'll be constipated, you might have that mass still, and a decreased appetite because poor sucking response, they're not really able to eat or drink. So that's going to be it for that one.